Good afternoon a second time. Thank you very much for your patience. My name is Malte Gerhold. I'm the Director of Innovation and Improvement at the Health Foundation, and it's my pleasure to welcome you to this Health Foundation Summit on AI in the NHS. It's great to see a packed house here at King's Place, and it's also great to see 2,000 people signed up online for a live stream, which is fantastic. Right, without further ado, let me introduce you to the Chief Executive of the Health Foundation, Jennifer Dixon, to open the event. Thank you very much.
Good afternoon, everybody. Welcome to this AI Summit, which is very exciting. I think you see from the huge demand, both in here and also online, that it's really struck a chord. Clearly, masses of interest, exciting interest, because of the potential of AI in healthcare. Can be huge, and that's why the Health Foundation is doing quite a lot of work now in this area and beginning, and hopefully we'll work with you and forge some useful partnerships with you today and beyond. AI, as you know, wherever you are on Gartner's hype curve, it is certainly a great hope, both for the quality of care, quality and safety of patient care, productivity, and also the sustainability of the National Health Service itself. I think technology really is a huge central hope. And if you think about it, if you think about the way that AI can be applied, a simple schema might be at one end is science and discovery, then medical treatments and diagnostics, then maybe service pathway transformation, and then population health, communicable disease, non-communicable disease at the other end. So all of that is very, very valid for the future of care and the National Health Service. But I think a lot of focus to date has been really on those first two areas, on science and discovery and medical treatments, probably understandably because it's linked to GDP growth and innovation and GB PLC. But actually, I think a lot of our focus today could really be not just on those bits, but also on the service transformation pathways, which is what we need it for, don't we, if we're going to shift care into the community, but also into population health side, both the communicable and non-communicable disease side. So I think we're really going to try and focus on the NHS and the service transformation side. And I think the key exam question for this afternoon really is, what is the most intelligent strategy for the NHS to pursue, particularly if you're focusing a lot on that area 3 that I mentioned, service transformation. What are the key elements to move forwards on if you're in your strategy? Regulation, a lot of focus on that to date, obviously because of safety, but then we've got a whole lot of stuff we need to do, how to test this stuff quickly and safely in a way that brings confidence to patients and staff, how to engage the public, how to send better demand signals to the private sector about what the NHS actually needs, not just for patient care, but also for its sustainability, how to move forwards best on data, given that money is short, where to put your money first. And of course, what are the next steps to get action? Even if you map this out, what's the acute, intelligent first steps to do that? So I think that's really what we're going to try and focus on a bit today, and hopefully we'll get some answers. Great conversations, I'm sure, great agenda, great people coming to speak. And I think hopefully this is the first part of a longer conversation we'll have. We start today, but actually we're planning something bigger next year so we can have a follow-up conversation and follow through. Now, we're going to have, as you know, Karen Smith. We're very lucky to have Karen Smith as the Minister of Health with us today. She's not yet arrived. So what we're going to do first is to have Nell Thornton, who's a senior colleague at the Health Foundation, who was recently the main author of a long read many of you have seen, which is what an intelligent strategy for AI in healthcare, that third area, what would that look like? What are the ingredients? And she's going to outline that for us today in the next 10 minutes or so. So I'm going to welcome up here Nell. Thank you very much. Over to you, Nell.
Hi everyone, good afternoon. Good afternoon to everyone in the room, good afternoon to everyone online. I don't know where the camera is, so if I've just looked in the opposite direction, then I am really sorry. So, nearly 75 years after Alan Turing posed the question, can machines think? AI is no longer restricted to run on 30-ton machines the size of rooms. It is instead probably in the pocket of every person here. And we are seeing this power applied in healthcare. From discovering new drugs to detecting tumours in scan imagery and even speeding up clinical note-taking, AI has captured the attention of policymakers and practitioners looking to tackle some of the service's most complex challenges. And it's easy to see why. Escalating demand, driven by an ageing population and a rise in long-term conditions, combined with significant workforce shortages, means the NHS must be doing all it can to capitalise on the opportunities presented by tech and AI to support staff, improve care quality, and boost productivity. And there is plenty going on already, but how do we make existing activity more than the sum of its parts? How do we turn the potential that AI offers into successful, widespread adoption and change? And this is a question that the Health Foundation has been focusing on, and I want to share with you now our 6 priorities for an AI in healthcare strategy. Because whilst there has been significant policy activity in the AI space, much of this has been cross-sectoral, and we believe that there is more to gain from healthcare having a specific focus. Now, we are not alone in being in the early stages of developing a strategy like this, but having a nationalised health system is giving us an enviable opportunity to develop a comprehensive and coherent approach more quickly. And I want to start by saying, when I talk about AI, what I mean always is responsible AI. To quote a famous philosopher, Uncle Ben from Spider-Man, with great power comes great responsibility. And this is never more important than in healthcare, where the power and promise of AI also brings significant risk. Without proper safeguards, AI can cause or magnify serious harms to individuals, organisations, and communities, especially when it is used in patient care. And there can be detrimental impacts beyond patient care too, such as the significant carbon emissions, water consumption, and e-waste generated by the development and running of AI models. And while safeguards and guardrails are all important to reduce the risk of harm, we argue that responsible AI development and adoption is more than just ensuring benefit for most people. It is instead about ensuring that AI ultimately benefits all people, society, and the planet. So where do we focus? Well, firstly, we believe that the use of AI should be shaped by the public, patients, and healthcare staff to ensure that it works for them. AI is creating new functionalities that will have profound implications for healthcare. Developing and using AI in ways that are compatible with high-quality care and that command the confidence of patients and staff will be critical for realising their benefits speedily. Now, this is not just about convincing the public that AI is a good thing. This is about genuinely co-creating with people to address poor user experience, as well as wider concerns around the social and ethics. And this is particularly important to do with those groups that are traditionally underrepresented in clinical research and tech development, so we can prevent bias and ensure that new uses of technology are rooted in a deep understanding of users' needs and what works well for them. An AI in healthcare strategy should also be based on a thorough understanding of what people in the UK think about AI-driven health technologies. It should ensure that there are effective mechanisms in place for engaging patients, the public, and NHS staff to inform high-level decision-making. This is essential if AI is to work for everyone. Secondly, the NHS must focus AI development and deployment in the right areas. While AI has significant potential, there are finite resources and attention available to support its development and deployment. We need to target efforts where they can have the most impact. And this is something that a dedicated strategy could create consensus on. And so far, the emphasis on more politically attractive clinical AI has continued to overshadow the significant potential of AI technologies for operational and administrative work, and the potential of AI to help reshape pathways and promote prevention and health. To ensure that AI technologies can be applied where they are most needed, we need stronger demand signalling from the health service. At present, the range and availability of AI technologies is being driven primarily by industry or focuses on where good data is already readily available. And while this is increasing the likelihood that we will be able to procure off-the-shelf solutions, it risks overwhelming organisations who are unsure which system is best for them, while also reducing the likelihood that these systems will match specific local requirements and populations. An AI in healthcare strategy needs to provide opportunities and mechanisms for NHS staff and providers to signal where AI could help the most. Thirdly, the NHS needs data and digital infrastructure that will enable it to capitalise on the potential of AI. If the NHS is to deploy AI at scale, it needs the right underpinning digital and data infrastructure at the right level of digital maturity. This includes effective mechanisms to collect, manage, and provide access to the range of data needed to develop AI models. And it also includes wider infrastructure too, like the right hardware and software, connectivity, cybersecurity, and interoperability. And while progress is being made all of the time, recent assessments show that overall data and digital infrastructure in the NHS is still not yet adequate, and digital maturity is generally low, with only a small number of exceptions. There is still further to go till we get the underlying basics right. An AI in healthcare strategy should ensure the NHS's digital infrastructure is fit for purpose and sets out processes that can be standardised to improve efficient access to high-quality data for the development of AI systems. Next, we need to prioritise high-quality testing and evaluation. A robust approach to the evaluation of AI-based health technologies is important to ensure the safety of AI tools, but also to build the confidence and trust needed to encourage their adoption and spread. The complex nature of AI algorithms, how they interact with people and processes in healthcare, and the speed at which they can develop means conventional evaluation models are often unsuitable. And then AI sprinkles in a few novel challenges of its own. Adaptive algorithms can change their behaviour after deployment, but static models can become less accurate with demographic shifts and changing healthcare needs. AI may also increasingly be used for purposes other than those originally intended. And then beyond the algorithms themselves, the complexity of implementing AI in a highly socio-technical system like healthcare poses evaluation challenges all of its own. To keep up with the pace of innovation, a new strategy must encourage greater investment in evaluation capacity to ensure the NHS and innovators are able to test and evaluate AI both pre- and post-deployment. Oh, I can't seem to get it to move on. There we go. Technology, hey? It's all about digital infrastructure. So next, to support the development and adoption of AI, we need a clear and consistent regulatory regime. And not just for the AI at the frontiers of the field, but for the systems that we already encounter daily. Under the current UK regulatory system, the wide and fragmented range of rules, principles, and proposals are failing to provide the necessary clarity. There is a need to address regulatory gaps and improve coordination among regulatory bodies. And we look forward to seeing what will happen next with legislation. But there is no shared overarching strategy to guide the alignment of these existing work streams, and confusion remains among innovators and clinicians as to the UK's regulatory stance. An AI in healthcare strategy needs to create a regulatory framework that provides clarity and consistency for AI developers and users. It must prioritise the coordination of sectoral regulators, bringing together all relevant bodies under an agreed approach that addresses both gaps and overlaps. And so last, but absolutely in no way least, and I know this is something we're going to be hearing a lot more about today, particularly in our second panel, but our last priority is that the healthcare workforce must have the right skills and capabilities to capitalise on AI. AI has the potential to boost both productivity and job quality if developed and deployed in the right way. But realising these benefits will rely on healthcare workers having the skills, knowledge, and capacity to implement and use AI effectively. Despite fears about jobs, much research suggests that, in healthcare at least, AI is more likely to transform the nature of work than it is to lead to redundancies. But there are still potentially negative impacts, like skill loss due to tasks being performed by AI, or diluting aspects of work that staff might find fulfilling, such as the quantity or quality of patient contact. An AI in healthcare strategy must set out concrete plans to equip the current and future workforce with the skills needed for using AI, develop career pathways that allow healthcare workers to specialise in AI, and empower staff to shape the evolution of their roles. The prize for establishing and delivering on a clear and compelling way forward for AI in healthcare is significant. It would not only help the UK economy thrive, but also help achieve better health outcomes and patient experience and a more efficient health service. But there is still some way to go. Thank you for listening, and I look forward to discussing this with our panel in a bit. Thank you.
Thank you so much again now for presenting on the priorities. So we're now focusing on our first panel, which will be about how we can make these priorities a reality. And so with me, I've got fantastic guests who I'd like to introduce. We've got Felix Greaves, who is the head of the Joint Digital Policy Unit between the Department of Health and Social Care and NHS England. We've got Rachel Power, who is the Chief Executive of the Patients Association and is going to talk to us from a perspective of patients and the public on AI. We've got Eric Sutherland at the far end, who is Senior Health Economist at the OECD and is going to give us an international perspective on how other countries are tackling AI in healthcare. And last but not least, we've got Harris Schwabe, who is the CEO of Newton's Tree, an AI company, and also consultant clinical scientist at Guy's and St Thomas's Hospital Foundation Trust. Thank you very much. So we're going to start with each of our panelists to give a brief response to what they've heard and a perspective on that, and then afterwards open it up to questions from the floor and our online audience, for which, as a reminder again, we're going to use Slido. Right, without further ado, Felix, if I can invite you to give a perspective from the national policy view.
Well, absolutely. And so, first of all, thank you so much for the invitation. But also, thank you so much for this work, because this is really excellent work. And as ever, the opportunity to work with good policy making and good policy thinking happens by that collaboration with think tanks, with industry, with academia. And so I think it's lovely to sort of be here and have the opportunity to think through this with all of you here. And so I'd say thanks for the report. Reflect a bit on where we are on the AI journey, and then think about some of the things that we are doing. But we are sort of also, to flag, not making any policy statements or announcements here, but just sort of working through that thinking process. So where are we sort of with AI? I think we've seen a step change. We can all see the real sort of exciting potential for this to transform the health system from how a patient experiences it to how it changes the workflow and sort of some of the tasks that sort of the hard-working workforce across the NHS and the care sector sort of working. So real opportunity to change the working environment for staff and to drive that sort of economic growth sort of that is sort of core to this government sort of agenda. And so we're really looking forward to thinking about how we can sort of do all of that. But this moment where it's sort of we're kind of ready to think about how we can really scale and industrialize the use of sort of AI in the right places for the right task. And that's why I really like that one line about sort of one of the strategic intents about making sure we're doing it for the right things and finding those places where we can really make a difference. And I really like the point that both Jennifer and Nell made about how we yes, let's look to that stuff about treatment, and so let's look at AI as a medical device, and it's brilliant at looking at images, and it's potentially sort of in the right way and with a good evaluation, it can sort of make accurate sort of diagnostics, but it can also do some of those high volume sort of churn things, and so that back office functionality. And if I'm honest, the regulatory landscape is complex, and appropriately we've got to protect the public and do things responsibly. I think some of the earlier things we might be able to really deploy AI at scale are probably in some of those back office functionalities. So let's look to those and let's explore. So again, you touched on the regulatory environment. I agree, it's complex. And if you're coming into this, if you're a young startup company with a spring in your step, and then you come across this regulatory environment, crumbs, it's tough. And healthcare should be tough. Healthcare should have high levels of sort of rigor and scrutiny because it's about protecting people. But we also want to be dynamic, responsive, and creating a system that enables people to do that. So I think there's been really great progress already with sort of some of the linking up around sort of the work that MHRA do, that NICE do, that HRA do, and there's this sort of the joint sort of AI regulation service. But that's just the start. So we really need to think, and I take that point that was made very strongly, that how do we bring this together as a whole, and how do we sort of sell it in a simple and understandable way, and give that clarity about what level of evidence we require, because you also spoke that evidence point up there. And in some ways, AI, it does have these strangenesses, these foibles that make it sort of really quite hard to evaluate. But in the same way, I don't remember, in about 2018, we were talking about whether we should have a different evidence standard for digital technologies, whether there should be a digital exceptionalism. And actually, I think in the end, we want things to be held to the same standard, but we want to develop these really dynamic, clever, rigorous approaches to evaluation, making the best use of real-world evidence and those things to be able to deploy these things into the service at increasing scale. And that's why I'm really excited by some of the things that, for example, NICE is doing with the early value assessment, the EVA in the jargon. There's a lot of acronyms in this game. But this ability to take things that have promise and release them out into the system, almost with L plates, saying we're going to keep a very close eye on it, we're going to be constantly evaluating. But so there's that possibility there. And so, so how we can work together and bring, I think there's the government role to bring together the whole health family, all the regulators to do it, but how we can support the system to do it. If you're thinking about purchasing an AI product in the system at the moment, it's hard to know what's the standards, what are the approaches, what do I have to do about IG? And dare I say it, it's not the most mature evidence market out there. Some products have got great evidence, some less so, and how we can steer and support the local system. And so what's the advice we can provide? I don't think this is one where we want to have sort of the iron grip of the centre, but more how we think about how we can support sort of this AI development and activity sort of elsewhere and at the local level, and how we work and how we think creatively about partnership with academia, with industry, using the great infrastructure we've got in NIHR to sort of allow us to do that. In fact, I don't want to go on too long because there's such a brilliant panel and we want to take those questions. So I'll leave it there, but just to say, look, I think those things that you've picked up, those core themes, really are sort of are wise and things that we should be looking to think about. Whether we should have a specific strategy on this, I wouldn't want to state at sort of this point. But the other point I would make is, for most of those things you put up there, that's what we want for the broader medtech innovation system. So actually, what we need to do, if we could solve these things for AI, we'd be solving for them. So whether or not we need a specific AI strategy or a broader medtech innovation strategy that brings all these common themes together, that's what I'd really like to explore. But thank you for your work. It's been a great read.
Well, thank you, Felix, and thank you for saying thank you. Staying with the national perspective and moving to the international perspective, but I guess also there's this point around collaboration that is required. If we come to you, Eric, how have other countries done it? Is there something we should learn? Is everyone in it at the same time at the moment? Has anyone tried to make that connection to growth and wealth as much as our new government is doing that at the moment?
Well, first of all, much in the same way with my colleague, thank you. Thank you, everyone, for your attention and your time, and thank you, everyone online. I'm truly honored to be here, and I'm probably the only person in the panel who doesn't have the broad British accent, although my parents are from Glasgow. So I actually had a Scottish pin in my pocket and decided probably the right thing to take it off right now, just in case. Any case, I work at the Organization for Economic Cooperation and Development, otherwise known as the OECD. And my role at the OECD is a small little project. I sit at the intersection of all things digital, which includes AI, security, data governance, and all things health, be it primary care, secondary care, pharmaceuticals, public health and safety, et cetera. So that's my little Venn diagram, and I have a lot of fun playing in that space. And I wanted to start by saying there is good news and there is bad news. The good news is AI is already improving lives every day. Wherever we are in the world, AI is already improving lives. This is not some sort of futuristic, we think it may. It's like, no, it's practically doing it. It is saving human lives. It is improving quality of life. We know this already. The bad news is it is doing so inequitably. It is doing so in pockets, in silos, in a very, very fragmented fashion. And that is also happening everywhere. Simply because many of the investments we've made in digital tools and technologies and in data in the last 50 years have been highly fragmented. And in the same way that AI relies upon a steady stream of good digital infrastructure and data infrastructure, frankly, we are at a place without that good, solid digital and data foundation. Trying to realize our AI aspirations is a challenge, and that is true everywhere. Simple way I can put it is, if AI are the taps You can't have taps without water, and water are your data, and you can't do that without your pipes, which are your digital tools and technologies to transport it. We need to have a coherent strategy that brings together the pipes, the water, and the taps to achieve our collective gains, our aims that we want going forward. And as I reflect on what other countries are doing, frankly, many of them are at the same point. Frankly, you guys are a bit ahead of the game, simply because you're asking the question, should we have an AI in health strategy? And I think that what many countries are starting to realize is there is something that we need to do here. We don't have the ingredients in place to achieve the outcomes we want. And what we were seeing is the initial reaction is acts, lots of acts, EU AI Act, US executive orders, Canada has the AI and Data Act. So we're seeing acts that are put out. But many of those acts are generic. They're AI. And frankly, focused on how do we prevent cognitive intelligence, general AI from being created. We're worried about the fear, and so let's mitigate any possible badness happening. But what we're doing, because we're doing that, is we're mitigating any good happening. Because we're putting the fear, we're so afraid of the negative that can come from it, we're failing to realize the opportunity from the good can come from it. And I personally think that it's imperative that we move forward with AI in a strong, positive way while we acknowledge the risks that are associated with it. And that's why I actually explicitly enjoy the approach of focusing on the foundations, the administrative functions of the systems, because it is not where people's lives are at risk, it's where we're improving the quality of workers' lives, we're improving the quality of health lives, we're improving the experience for people. That's where we should be focusing our efforts. So at the OECD, we have an AI and expert group we created back in 2019, have AI principles. What we did this year is we created a specific group about AI in health. It sounds like we think, and not sounds like, it is the fact that we think it makes sense to look at something at the specific intersection of AI and health. Both AI is complex, health is complex. If we try and hope that the complexities resolve themselves without having some focus on it, it's never going to happen. And so we're looking at the complexities and we're looking at 4 specific areas. What are the policies that need to be compatible? What are the standards that need to be harmonized? What are the incentives that need to be in place to encourage scale of AI solutions, not just the implementation or the development, but the scaling of solutions? And how do we foster trust with the people who use AI, which is to say the public and health workers? So from the perspective of the 4 things we're looking at are very aligned with the 4 things that the Health Foundation has come up with. We're very happy to actually amplify the work you're doing, and we're looking forward to really continuing the conversation.
Eric, thank you so much. Now, Rachel, Eric talked about the role of trust and also fear in this. What does this look like in terms of the conversation that we actually need to have to make it a reality?
Brilliant, thank you. And here's an Irish accent on the stage, so you're okay, you're in, yeah. At least it better still sound like an Irish accent after years here. So, hi everybody, and thank you so much for inviting me. My name's Rachel. I'm the Chief Executive of the Patient Association, so we're a non-disease, non-condition specific patient charity, and we've done a lot around, and there's a couple of points I want to pick up. I think the first thing I want to pick up is why patient involvement in AI implementation isn't just crucial, but is an opportunity. Is an opportunity to implement AI in healthcare faster and more responsible. And the approach aligns with we have core principles about patient partnership, and that aligns with those, and the concept of obviously responsible AI that you spoke about. You know, we think very much to address why sometimes people worry that involving patients is a challenge, but actually it's a significant opportunity to improve AI better and faster. And I think it accelerates AI implementation by resistance to adoption through trust building, design efficiency, because we're going to be focusing much more on patient-centered features, health inequalities, and I do want to come to that for a little bit more, but tackling in specific digital health inequalities by helping patients to understand how AI can enhance patient experience. And I think for us, that building that broader public confidence in AI solutions at a time when trust isn't as happened at its highest. So I was really happy to read your report, because it was great to see a report starting with talking about how do you engage patients in AI development, ensuring that new technologies and AI truly meets the user's needs. And there will be trade-offs, and there needs to be trade-offs, and we need to understand those trade-offs. And some of those trade-offs for me are around human contact versus AI-driven efficiency. While it might speed up process, it may reduce face-to-face time, which is important to a lot of patients. The data privacy is still going to be a big issue for the moment, as we really need to look at that comprehensive data collection that will lead to better AI performance. That rapid diagnostics versus explainability, allowing patients to have power. And we know that in successful health and social care systems, patients have power and that they're listened to. And there's a lot of work going on around epistemic injustice where the patient story isn't listened to. So we've got to be careful that we don't exacerbate those. I get that AI can personalise, but there can be a level of standardisation versus personalisation, and that for me is really important. But I think those trade-offs, we can find optimum balances by making sure that we're starting involving patients in the very, very beginning of this, and that is around that principle that we have around shared decision-making and patient partnership, which, you know, is in your report very crucial to responsible AI, which requires transparency and accountability. So I really think that if we involve patients at the beginning in the design and delivery of these tools, we'll truly serve the patient need. Because we do read, and there are studies where AI has exacerbated health inequalities, and particularly for minority ethnic groups and those facing poverty. And this concerns me greatly, as this is about recognising those inequalities at the very beginning of the design and delivery of services. But patient involvement can really help in AI development, incorporating cultural contexts, using representative data and conducting inclusive accessibility testing, being at the very front of it. So we just completed a piece of work with the department around the Data Saves Lives strategy and the Data Pact. And that was a really interesting piece of work, because actually the department were really, really brave, and they gave us a blank sheet of paper. Because I kept saying, give me a blank sheet of paper and we'll tell you what patients need to know, and then you can respond to that. And that is brave, and not many people do it. They did it, so I will give them that credit. But what came out strongly was we really need to build that trust. That's not there yet. And in order to do that, patients told us that the quality of data needed to be improved. And that we needed to ensure that clinicians fully understood what data meant for patients' care, be clear about the relationship between the NHS, the private sector, and data use. And any commitments that we made about data use needed to be underpinned by legislation and good legislation, with clear enforcement mechanisms. And one of the interesting things, and I will come to an end because there is a brilliant panel, but one of the really interesting things that came out of it was, you know, I think sometimes we're feared to have this honest conversation. And a patient said, there will be data breaches. We know there will be. Like, of course there's going to be. There's data breaches across the world. Just tell us. Just be transparent. Tell us what's happened and what you're going to do about it, rather than trying to pretend it's all perfect. So I think that's really big. So I'm going to finish up, because patient involvement in AI is not a hurdle. It's a catalyst for better, faster, more efficient and more equitable AI in healthcare. And the future of AI isn't just about smarter hospitals, smarter diagnosis. It's about empowering patients, reducing health disparities, and truly patient-centred care, and involving patients every step of the way, and guided by the core principles that we work to and the concept of responsible AI. Really believe that if we work together, we can have the future of AI becomes a reality sooner rather than later. But we need to make sure that this message reaches everybody and those at risk of digital inequalities.
Great. Rachel, thank you so much. And particularly that point for the collaboration with patients and with the public, actually making this a success and an equitable success, rather than just a requirement for that. Great. Harold, let's turn to you as someone who both is trying to make AI work through your company, but also works directly in the NHS. all these conversations around national policy, international collaboration, regulation, actually what would help to try and do this as someone in the NHS?
Yeah, well, first of all, thanks for inviting me. Happy to play my role. It's difficult to add to what's already been said. Before I get into reflecting on people's comments in the report, what I will say is we've come a long way as a country and as a health system when it comes to AI adoption. I often sort of joke about when I would go to sort of clinical academic conferences in the States sort of in 2017, 2018, would be absolutely terrified at the kind of work that was happening, particularly in the States, from institutions like Yale and Stanford and Johns Hopkins, and thinking, oh, how will we ever get to this level? And I just took a contingent from St. Thomas's, the team there. There was about 7 of us in DC last month, and it's completely flipped. But it's not because of what we've done at St. Thomas's, it's because of all the stuff that's happened nationally. There's been serious amount of investment in this country, directly in terms of cash, policy development, infrastructure and education, that's allowed us to take a serious leap forward, right? And it culminated in a very funny conversation I had last night, actually, which I was telling some colleagues at the drinks and lunch earlier, where I was chatting to the head of AI at MD Anderson last night. So the #1 cancer hospital in the country, in the States, probably the world. And we were talking about how we do AI adoption at St. Thomas's, and he was sharing notes about how they do it at MD Anderson. And he said, Harris, have you heard of this document? It's called BS304, and I finished it for him, 440. And I said, yes, because myself and many people in this room, I see them in the audience, wrote that document. We wrote the first standard on how do you validate AI in healthcare. And institutions around the world, like MD Anderson, are following our lead now. And so we have to give ourselves a bit of a break and a bit of a pat on the back. Now, and thanks to people in the room, I see them now, who did a lot of the hard yards over the past few years for us to be in that sort of position. But reflecting on the report and more broadly sort of an AI strategy for the NHS and what does that mean for sort of little old me at St. Thomas's, opposite the House of Parliament, trying to do a good job. I think there's 2 really important things to keep in mind. One is people, and one is the journey. And I appreciate, Nell, you highlighted, one of the priorities was about investing in people, and we've been trying to do that. We run a national fellowship program specifically designed to train and educate doctors on how to use AI in their daily working life. But really, every one of those priorities is a people problem, right? So you can't have digital and data investment without investing in digital and data people, right? We are not in a system, we are part of the system, right? And so when we talk about investing in a regulatory framework that's efficient for everyone, we need regulatory people who then operate that regulatory framework. And that needs to be actually a thread that runs throughout all of these priorities, is how are we investing in the people that are going to form this system itself? And then the second reflection is the journey, the roadmap. It's a fantastic piece of work, but I think we'd all in the panel and definitely in the audience agree or have broad alignment. Yes, these are the strategic priorities. But how you get there makes a massive difference. And if I can use sort of a analogy, if you think about Frodo's journey to Mordor, it's probably one of the hardest journeys you'd want to take to destroy some jewelry, right? And in the NHS and in public services in general, we seem to choose a really hard way of doing stuff. Even if what we're doing everybody agrees on, we seem to do the hardest way, where we end up almost killing ourselves, hating our best friend, and the eagles have to save us. And there's other ways to do this, right? There's ways that are self-sustaining, where actually it's enjoyable and not risky. But it requires choosing your road carefully. And so what I would love to see is the next step, which is the AI roadmap for the NHS.
Great, Harris, thank you so much. So we will open it up to questions now, which I have here on the iPad. I'm also pleased that we've managed to get Spider-Man and Lord of the Rings into the conversation so far for that. There's over 40 questions that have come through, so I definitely can't take them all, but I'll try and combine a few on that. And the first one, maybe if I stay with you, Harris, on this one, which was asked about how can staff, when they do courses and training on AI, and you mentioned the fellowship, for example, but then often might be working in organizations that do not have great digital maturity or capability or data sets, how can they translate what we might be able to help them to learn into their actual workplace? And then what was related to that, and maybe Eric, I'll come to you on that one, because there's another question around the equity of this. How do we avoid not having what the person who asked the question calls an AI aristocracy, where all the big teaching university hospitals are able to do this because they've got the money, the capability, the data sets, etc., the IT, whereas others are really struggling and left behind. But if I start with you, Horace.
Yeah, no, happy to. It's completely correct and almost hits the nail on the head. And I've experienced this with the fellows that we educated, but I also have experienced this sort of myself. A few years ago, I was part of the first cohort of Topple Fellows. And you go out and you get involved in this sort of program, you get upskilled and trained, and you think you're wonderful, and you can make all this sort of, you're going to be an agent for change, you're going to be a revolutionary, and you go back into the hospital, and your CFO's like, who are you? What are you talking about? And this is the point around people, investment needs to be everywhere and in everything, right? It's not enough to say, oh, well, we're going to train the next generation of doctors. The next generation of doctors are going to have to speak to the next generation of CIOs and finance people. And if you're not investing in those functions and corporate functions as well, then you're going to have a lot of expenditure and a lot of investment, but still the same kind of bottlenecks. And so we need to think about education at every level. Right? And it's the same thing, for example, you might have clinical AI leaders, but if we don't have general AI literacy for people who are operationalizing these things, then nothing will get off the ground because it would be too risky. And if I can sort of like jump in on Eric's question as well around teaching hospitals and coming from an ivory tower, I think that there has to be serious responsibility put on those institutions like St. Thomas's to do some heavy lifting for their regional area and domain. Because you're not going to get a 15-person AI team in Lewisham and Greenwich. But we're a mile away from Lewisham and Greenwich, and there should be some responsibility on my team to support Lewisham and other hospitals.
Yeah.
Eric, any learning from other countries about that challenge of an AI aristocracy?
Well, it's a real concern, and as I said with my bad news earlier on, I think what countries are realizing, and it's similar to that, there are pilots that are in place around the creation of integrated health teams, where which are more or less that regional model that we were talking about, where a regional facility is the anchor for a particular geography, and they support not so there may be a more affluent teaching hospital, but they're for a larger catchment area and are responsible for supporting that entire area with their foundational capabilities. The real challenge is that our funding models tend to be skewed to be on a per capita basis. And what we aren't doing is recognizing the foundational investment that is required in many of our institutions in the digital age. You have to procure software, digital infrastructure, data infrastructure, et cetera. And then after you've invested X, and X is the same for every institution, then you scale it up by how many people you're actually serving. Because we have a legacy model of funding hospitals by the number of people they're serving, the challenges are that they can't afford the right digital infrastructure, the sufficient and sustained investment in the people and the tools and technologies. Exactly to your point, that it is not just about buying software. It's about buying the people who will support the software on an ongoing basis, having the capabilities around that in sufficient capacity wherever you go. And so all of that is, we have to think about what our funding models are that help equitability in the digital age, which is different than the analog age that we were coming out of. The digital age is different. It is more networked. There's more capabilities, but part of the network is unlocking the value of networks. Having things like you supporting Lewisham, that is unlocking the power of networks. We have to be creative about how do we create that environment and just make it natural in our cultures.
Great, thank you, Eric. A couple of other clusters of questions. If I come to you, Nell, maybe first, and then so Felix, around the priority that you described now of focusing on the right areas of AI. And the first question is, are there certain characteristics of AI that make it less or more suitable for deployment in certain areas, clinical or non-clinical? And the second question, well, maybe also come to you, Felix, on that, is how do we go about identifying what those areas are and then putting effort and capacity behind it?
Yeah, it's a good question. But if I can push back slightly, I think it's the wrong way round. I don't think it's about starting with looking at what the technology can do and then finding an area to push it into. It's about starting with the challenge. what is the challenge that we are facing? What do we need this piece of technology to be able to do? What would be the best outcome? You know, is AI even the solution that we need? Actually, quite often there's a simple statistical model that you can use, or maybe it's not even that at all. We're quite often sold AI on the promise that it will fix everything, but that doesn't necessarily mean it's the right solution. So it's not about the characteristics of the technology being fitted into the challenge. It's about what are the characteristics of the challenge? What do we need? And then working together with developers, with the public and with staff to create a piece of technology that has the solution that you want it to have.
Great, thank you. Felix?
I mean, One Health Ed would be my first advice. But absolutely. So, and when I imagine there's a few technologists in the room. I count myself as one. And, you know, it's possible to get excited by the technology and sort of the whiz-bang, what it can do. But actually, the core questions we are trying to ask are the questions of the health system. So how we find and identify those, and whether it's the junior doctors who are spending sort of too large a proportion of their time writing discharge summaries, which is a relatively sort of, you know, a task that could be done well by AI, sort of, or is it sort of the high throughput screening service where we know we don't have quite enough sort of radiologists to be able to sort of look at things. We know there's skills and staff shortage issues. You know, it's about picking those questions and actually. And so I think that's, you're right to challenge us on this, because I think that's the job of a health system, a really listening health system, and not for the ivory tower at the centre of the health system, but to be out there listening to the voices from the front line and saying, these are the problems that we've got that we think might be amenable to sort of AI-based solutions. I think there's good progress. There's the NHS England sort of horizon scanning team. There's great work that's going on at NICE, thinking about what those questions are, how we can bring those thoughts together, how we consolidate them, how we create an agile mechanism to hear those asks, and then task the AI to our questions and our problems, and set clear challenges perhaps to academia and to industry to say, these are the areas where we would really value your input, your clever new solutions, and sort of being clear about what those are and what the evidence that we would expect in those spaces are. So yes, we should bring that together and say what the system needs at the front line.
Great, thank you.
Can
Rachel,
I bring one sentence into
yeah,
that?
go on. I was going to bring you in.
Yeah, just, you know, yes, we need to fix the system, the issues that the system are facing, but if we look at health, we need to fix the issues that patients are experiencing, and I think that's where AI has to start with, because we've had fantastic we've had fantastic transformation in the healthcare system, but sometimes it doesn't work for patients because we didn't start with them.
Can I pick up on that? Because I think you're absolutely right to challenge that. And absolutely, so listening to the front line, but centrally listening to the patients. And also understand, I think there's probably going to be quite a lot of sort of views from patients. For example, when we think about sort of digital approaches, AI-driven approaches to mental health, the early research shows that some people really quite like the idea of talking to sort of an AI approach. Yeah. Some people really don't.
No, shared
and actually being able
making.
to understand sort of those and your challenge earlier about what we can do to at the centre to listen to the public voice. And we've been doing work with sort of the thing you mentioned about the blank sheet of paper, thinking about sort of data pact and data opt-outs. We've been doing some of that deep deliberation with the public, really spending time out and about around the country, talking to people about some of our data things.
We went and did it for you.
Well, we are very grateful. It's gone really, really well so far.
It has gone very well.
So how we can extend some of those, that's really got me thinking about how we can extend some of that into the AI space.
And I think it's frontline staff, absolutely. You have to listen to them, but frontline staff and patients working together will feed the system what we need in innovation from an AI point of view in any transformation.
And Rachel, because there's a question related to this here, so definitely talking to patients and public and staff about what are the needs we want to address and how. Whose responsibility is it to do that well? Is it the NHS? Is it the tech companies? If it's the tech companies, particularly if you're a really small company compared to a really big one that has lots of capacity or money to be able to do it, do you have a sense of where should we put the onus to do that?
I think it's a really good question, and we've worked with tech companies. We're working at the moment on a patient guide, and I think the more you look at kind of the funding routes for smaller tech companies, there's going to be an expectation that they've worked with patients and the public to develop it. So, but I do think this is about partnership, and whenever I talk about transformational healthcare, I talk about the NHS, the department. So it's the system, patients and industry working together to make sure we're learning from each other at all times. So those small tech firms, if you're 5 people, but the amount of phone calls I get from not just tech firms, but small companies telling me that they know what patients need, and I don't think you know what patients need. Just, if you're only 2 people, you still don't know what patients need if you're not sitting, working, and also always thinking of those people that we're continuously leaving behind. So we did a piece of work we did with British Red Cross on forgotten neighbourhoods and underserved neighbourhoods, and we're just starting another piece. These people are not asked how tech's going to work for them, how AI is going to work for them, and if we start with them, it'll work for all of us.
Great. Harish, this example of how to really involve staff, but also patients, what does that look like when you work, for example, at the Trust?
I mean, I'll be frank, it's really challenging. In a resource-constrained environment, even at sort of big teaching hospitals, it's really difficult to prioritize this. But then also, there are some fundamental questions that are very difficult for individual departments and hospitals to answer. So I'll give you a very specific example. So one of the first AI deployments that we had at St Thomas's was around pediatric bone age analysis. So this was basically young children, you take an x-ray of their hand and a radiologist basically pages through a book and ascribes a bone age to that child to see how well they're developing. And we had an incident where some of the consultant radiologists were complaining that the AI was getting it wrong. And so we said, okay, well, this is weird. We evaluated it, it seemed to work fine. So we investigated. And in this particular instance, so with children under, I think, the age of 4, and Susie's probably going to correct me, that you're not supposed to use the carpal bones to make this assessment. And the AI was correctly doing it, and that group of consultants were incorrect in their assessment. And that was an interesting challenge because it was a sort of a retraining opportunity. But then the question became, what do we tell the patient? And who do we tell? Who tells the patient? And fortunately in this scenario, it's not a clinically a serious situation than if this was, say, an oncology MDT. If this was somebody, say, cancer treatment MDT, and the AI said we should take this treatment plan, and the oncologist said something else, this disagreement, what do we do about duty of candor? Is the dyadic relationship between doctor and patient now triadic? I don't know, is the short answer. And that's very difficult for a clinical department to come up with a sensible answer. But this is where engagement between the centre and the front line is critical. Because I'm pretty confident a lot of people in the centre are the first time hearing this story. But there's loads of these stories. Well, not loads, but there's a few of these stories. And it's important that the people who are setting policy have visibility so that we can together as a system figure out how to effectively support staff and patients in these conversations, because they're not easy.
Great, thank you. Eric, if I put that question also to you and then we'll wrap up the panel. Are there international examples where this conversation around AI has been done really well that we can learn from?
So internationally, like the places where AI is driving furthest, fastest are in the United States. The United States is not necessarily the model of a health system that you want to be mirroring from the UK's perspective. And so there is huge innovation that's happening there. I saw a presentation a month ago where people were growing human hearts for transplant, which was the reflection of that was AI may be math, but what they're doing at Stanford, that is magic. So it's pretty exceptional stuff that they were doing. But I think that from the UK perspective, you guys are uniquely positioned of having many of the foundational ingredients you have to have in place in order to do AI successfully and at scale. And so I would really encourage you to think about how do you leverage the current structures you have around the NHS, the current structures you have around the various health trusts that you have across the country, the willingness to engage with this, the intelligentsia that you certainly have massively within the UK. The other country I would oddly point to, which not necessarily the first one you would think of in this space, because mostly people think about digital health advancements as being in the Nordic countries and probably point to Finland first. Oddly, I'm going to point to France, not just because I live there, but because they actually have done a tremendous amount of work around AI, especially around their centralized health data hub in the last year, really to unpack what some of the policies they have to do the enablement of this work. It's certainly a space I would look to them about some possible north-south collaboration, so to speak. But I think that the UK certainly is exceptionally well positioned to take a leadership role globally in this space.
Eric, thank you so much. So, Eric, Harris, Rachel, Felix, Nell, thank you so much for joining the panel and your contribution. Thank you very much.